The broadcast is now starting. All attendees are in listen-only mode.
Well, good evening. Welcome to another edition of Question Lab. I'm your host, Jeff Downing, and here to welcome you to another session where we're going to slice and dice some questions. Tonight, we're going to be looking at neuropathology. I know some of you may have signed up thinking that tonight was going to be GI Path, but tonight we're switching it around a little bit. So we're going to go. We're going to focus on the brain tonight. So we're glad you're here. I'm glad you're here, and I want to introduce my co-host tonight, Sean Nanji. Sean, would you like to introduce yourself to the crowd?
Sure. Thank you very much, Jeff. Sean Nanji here. Been with RX Coach for several years now, working with students like you and coaches to help you on your academic journey. Looking forward to another Question Live and webinar tonight, and thank you all for being here.
Okay, with that, let's go ahead and start tonight's Question Lab with question number 1. Now, if you are new, you're going to see something a little bit odd, right, as I open this up. There are no answer choices. So, and we do that by design. So, our first step is we cover up the answer choices. And the reason we do that is because we really don't want you to get distracted or disoriented by an answer choice that you've never seen before or that you're not confident in. So we say cover up the answer choices and start by reading the lead-in. Now, in a board-style question, the lead-in refers to the question. So in this case, the lead-in is, which of the following is the most likely cause of this patient's symptoms? Okay, so you've got your lead-in there. We say start there because from here you can get a sense of, well, what kind of answer are you going to be looking for? What kind of information are you going to need to train your focus on when you're reading the vignette? Every now and then, probably every blue moon, essentially, you will see you'll get a lead-in that is obvious enough that you could actually answer the question without even reading the vignette. USMLE has cracked down on those. You don't see those types of items much anymore. But again, we definitely see the value in starting with the lead-in and then going back and reading the vignette. So the vignette is the case, and let's read that together. A 10-year-old boy is brought to the pediatrician with 1 month of headache, nausea, and vomiting. The headaches are dull, worse in the morning, and not effectively relieved by acetaminophen or ibuprofen. He does not report snoring. On examination, the physician notes impairment of upward gaze. Results of fundoscopic examination are shown. MRI of the brain after contrast reveals an abnormal mass with calcifications located at the third ventricle. So again, we read that lead-in. Which of the following is the most likely cause of this patient's symptoms? Now, what I'd love for you to do is to go down to that question box and let us know how many steps you think it will take to solve this. Do you think it's a one-step question, a two-step question, three-step question? As you're doing that, I'm going to pass it off to Sean to take you to the next phase. Sean?
Well, thank you very much. Happy to guide you through this. We'll take a look at the next slide here. As you can see here, it says we've got a 10-year-old boy, 1 month of headache, nausea, and vomiting, dull, worse in the morning, and not effectively relieved by acetaminophen or ibuprofen. Then we see here is got impairment of upward gaze, abnormal mass of calcifications in the third ventricle, and what's the most likely cause of this patient's symptoms? So we've got some information here. We've highlighted these clues for you. Nice little image there for you guys to take a look at. Let's go ahead and take a look at these answer choices. So when we look at the answer choices, we'd like to start at answer choice E and work our way up to A. And the reason we do that is because oftentimes students will start at A, pick what they like, and fail to read all of the answer choices. And this kind of forces you to go through all of them and not jump to conclusions. So let's start with answer choice E, pituitary adenoma, D, pineal tumor, C, hypothalamic hamartoma, B, epidermoid cyst, and A, craniopharyngioma. So with that, we're going to go ahead and open up that poll and give you guys a moment, give all of you a moment here to lock in your answer choices.
Okay, so the question, the poll has been launched. Which of the following is the most likely cause of this patient's symptoms? You've got your answer item. So go ahead and take your best shot. If you know it, go ahead, lock in your answer. If you don't know it, it's okay. take your best guess. We do want you to remember that on test day, you should never leave any questions left unanswered. You're not going to get penalized for it, and you might get lucky. So make sure that you're not leaving any of these blank. For each of these, we typically wait until about 2/3 of you have voted, and we're getting close to that. So go ahead and make your selection. I see a couple of folks who have answered in the question box. That's fine. It's nice to see that as well. Make sure you're using the quick poll though too. Okay, so let's go ahead and close the poll and see what you thought the answer was. So top vote getter, craniopharyngioma, answer choice A. While pineal tumor also got about 1/3 of the votes here. So kind of a sort of a 2-horse race here. So let's go ahead and hide the results and share the answer. And the answer is answer choice D, pineal tumor. So I think that this one, a little tricky for some of you. There was something that was leading you to answer choice A. So what we're going to do is break it down for you. Sean?
Well, thank you very much, Jeff. So, let's look at the symptoms here, right? We've got headache, nausea, vomiting, and if you combine that with the fundoscopic image there, which shows swelling of the optic nerve head, we call that papilledema, right? So that's really suggestive of ICP, or increased intracranial pressure. Now, if you look at the other image here, which is the MRI image, and I'm not sure if you guys were able to see it earlier, but they did tell us about it. Right? They told us that the patient had abnormal mass with calcifications in the posterior third ventricle, and that's going to be consistent with a pineal mass, right? And this is a very rare condition. It only accounts for about 1% of primary brain tumors. And the big thing here to realize is that the pineal masses will typically manifest with symptoms of increased ICP as well as Parinard syndrome, which is characterized by vertical gaze palsy and pupil abnormalities. And you'll confirm that by looking at an MRI image or having them tell you that there is going to be an abnormal mass in the posterior third ventricle. So all those clues in the eye condition, the gaze palsy, especially the vertical gaze palsy, as well as the pupil abnormalities and the increased ICP, should point you, along with all the clues, to it being a pineal mass. Now, why are the other answer choices incorrect? Well, if you look at a pituitary adenoma, kind of similar to a craniopharyngioma when it comes to symptoms, you're going to see what we call bitemporal hemianopsia on visual field testing, right? Now, bitemporal hemianopsia is not what we're seeing here, right? We're seeing what they described and told us was a vertical gaze palsy. So based on the vertical gaze palsy, you can rule out craniopharyngioma as well as pituitary adenomas. And there's a nice little chart in first aid that kind of goes over all of the different visual field defects, and I highly recommend you take a look at that if you haven't already. D was the correct answer. Then we have hypothalamic hamartoma. Now that's going to be, associated with a different set of symptoms, specifically seizures, cognitive issues, hormonal imbalances, and precocious puberty. And we don't have any of those symptoms being mentioned here, and you didn't fall for that because only 6% of you picked that. So you guys were able to avoid that trap. So well done there. The last incorrect answer here, epidermoid cyst. Epidermoid cysts, you'll see those, but when you see those, you're not going to see increased intracranial pressure. So really, the two most important clues to nail this question are going to be the condition with the eye, the vertical gaze palsy, pupil abnormalities, as well as increased intracranial pressure. Those three clues will really help you rule out the other answer choices and land on the correct answer of pineal tumor. Back to you, Jeff.
Excellent. Thank you, Sean. So those are some good, helpful pearls to be keeping in mind when you see this type of question connected with that. And as Sean mentioned, go ahead, Sean, if you're going to.
And that's, yeah, sorry about this. I forgot about the slide. So if you look here, you'll see pineal gland tumors, right? It says increased incidence in males. And you see here Parinard syndrome, triad of upward gaze palsy, convergence, retraction, nystagmus, and light near dissociation. So, when you see this in your first aid, remember, they don't have to give you every single clue to get to the right answer. They just have to give you a few of them. And oftentimes, they may not give you enough to get to the right answer, but they'll give you enough to rule out the incorrect answer. So you can get to the answer one of two ways. So hopefully you're able to see what they were trying to do to you here. A lot of you guys got it right. So well done, everyone. Let's move on to question 2.
Excellent. Okay, so here we go. Let's open up question number 2. So again, we've got all of the answer choices covered up, and we're going to start with the lead-in. Which of the following additional physical findings is most likely in this patient? Okay, so again, you're going to be looking at this. You know what kind of answer choice that you're going to be looking for. You can see that it's a most likely, which means, yep, there may be some multiple questions or multiple options here that aren't necessarily wrong, but what's most likely. So with that, let's read the vignette. A 25-year-old man comes to the emergency department because he has been dizzy and nauseated and unstable while walking since undergoing a chiropractic treatment for neck pain several hours ago. Physical examination reveals absent pinprick and temperature sensation on his right face, left trunk, and limbs, ataxia of his right extremities, left beating nystagmus, and hoarseness. So again, which of the following additional physical findings is most likely in this patient? I'd like you to go down and let us know how many steps you think it will take to solve this one as I turn it over to Sean.
Well, thank you very much, Jeff. So once again, we're looking at a question, likely 2 steps, right? We need to figure out what's going on and what the mechanism is. We'll go to the next slide and show you what we think is important in the stem and the lead-in. So always demographic information. 25-year-old man, he's in the emergency department. That's important because that tells you, it was either acute or serious enough to be taken care of right away. Dizzy and nauseated, unstable while walking, had a chiropractic treatment for neck pain several hours ago. Now you've got absent pinprick and temperature sensation. Now, anytime you have these neuro symptoms, you want to make note of what side these symptoms are happening on. So we've got right face, left trunk and limbs, ataxia of the right extremities, and left beating nystagmus and hoarseness. So what I normally do is I'll write down R or L on a sheet of paper and just write down what those symptoms are, or just keep track of it in my mind, because the only way you're going to get to the right answer is knowing how these symptoms fit in and what happens to each side of the body with certain blockages or conditions. So we've also got hoarseness in addition to that. So take those clues into consideration as we try to find the additional physical findings that we're most likely to find in this patient. So once again, the clue here is take a look at what side things are happening on. And we'll start with E and work our way up again. E, right-sided ptosis and meiosis. D, inability to recognize the left side of his body. C, hyperreflexia of the left extremities. Diminished vibratory sensation in the right extremities. And deviation of the tongue to the right, answer choice A. So we'll give all of you a few seconds here to take a look and lock in your answer choices.
Okay, so we are going to launch the poll. The poll is launched. Let us know, which of these additional physical findings do you think is most likely in this 25-year-old patient? Okay, so let's see how we're doing here. About a third of you have voted so far. We're going to have again, we'll have a raffle at the end of tonight's session. Also noted that we've got another webinar tomorrow night, how to build a study schedule. And we'll be using the RX study planner as part of our guide there. So encourage you to join in, as well as anyone that you know who might benefit from that. Okay, about 70% of you voted. Let's go ahead and see what the results look like. Okay, so for this question, about 41% of you voted for answer choice E, right-sided ptosis and meiosis, and about 1 out of 5 of you went with diminished vibratory sensation in the right extremities. Okay, deviation of the tongue to the right also got a number of upvotes, so kind of spread here, but let's see how we actually did. So we're going to hide the results and reveal the answer. And the answer is right-sided ptosis and meiosis. Excellent. So you guys, you nailed that one, or the majority of you did. That's good. Well done. If you didn't get it, that's okay. This is the time, if you're going to get something wrong, get it wrong during question lab, because our goal here is to make sure you get it right on test day. So to help kind of lead us through that, here's Sean.
Well, great job, everyone. This question is a tough one, and the answer is indeed E, right-sided ptosis and meiosis. So why is that, right? So remember, he went to the emergency department, so this was a sudden onset, and it's focal, right? So you're thinking he's got some kind of acute stroke, right? And that stroke in this situation is likely secondary to the chiropractic manipulation he just had, right? So in this case, the lateral medulla has most likely been affected by dissection or thrombosis of the vertebral artery, which then gives rise to the pica, or the posterior inferior cerebellar artery. Now, you're more than likely going to have a question on this on your exam or at some point, because it's a very, very high yield topic, okay? So you need to know what pica is and what happens when it's obstructed. So pica supplies blood to structures of the lateral medulla. That includes the vestibular nuclei and spinal cord tracts, as well as the inferior cerebellar peduncle. Now, if you have hoarseness or dysphagia, generally, it's fairly specific for lateral medullary syndrome or Wallenberg syndrome, because it points to a lesion of the nucleus ambiguus. Now, you can also have hoarseness in other high yield questions, and they'll talk about somebody having a surgery and maybe pinching that recurrent laryngeal nerve. That's not happening here. So when you have hoarseness not accompanied with surgery, right, you want to start thinking about pica being involved. And so what happens is dissection or thrombosis of the pica will lead to lateral medullary syndrome, and that will manifest as hoarseness, dysphagia, absent pain and temperature from the ipsilateral face, and contralateral body, vomiting, vertigo, and ataxia. Let me repeat that. You're going to have, with pica, hoarseness, dysphagia, absent pain and temperature from the ipsilateral or same side of the body on the face, and the contralateral part of the body. So ipsilateral face, contralateral body, vomiting, vertigo, and ataxia. Now, you can also have, with lateral medullary syndrome, ptosis, meiosis, and anhidrosis. All right, so that's why the answer here is going to be right-sided ptosis and meiosis. Now, why are the other answer choices wrong? Well, let's look at them starting from the bottom, working our way up. So we've got inability to recognize the left side of the body, right? And that's going to, really be indicative here of a lesion of the parietal lobe, which is supplied by the MCA, or the middle cerebellar artery. Now, there's a chart in first aid that goes over all the different blood vessels and what happened as a result, okay, with a nice diagram. And that's something that students always get tripped up when it comes to neuro questions. But when it comes to neuropath or neurophys, they're going to ask you questions about that. And if you can just nail that chart down, you're going to have a lot of success with it, not only on the exam, but also in practice. Okay, so hemi-neglect, left side of the body, that's going to be the MCA, not the pica. Hyperreflexia of the left extremities, well, that's going to include, that's going to indicate upper motor neuron damage. And whenever you have upper motor neuron damage, remember, you're also going to have spastic paralysis, okay? Spastic paralysis, you don't see that here, all right? Now we have here diminished vibratory sensation in the right extremities or deviation of the tongue to the right. That's going to be seen in medial medullary syndrome, not lateral. And that's going to happen because of strokes of the anterior spinal or vertebral artery. So a good physio question here that requires some anatomy knowledge here to get it right. For those of you who got it, great job. It was a tough question. Let's go ahead and go to the next slide. I think I put a chart in here. I'm not 100% sure. I could be wrong. Yeah, here we go. So this is pica, right? So this is what our patient had here. So as you can see here, area of lesion, right? We've got the nucleus ambiguus, right? Cranial nerves involved, there are listed. We have dysphagia, hoarseness, and then you see ipsilateral ataxia, and decreased pain and temperature from the contralateral body. We call that lateral medullary syndrome or Wallenberg syndrome. So it says here, don't pick a lame horse that can't eat, and that's the mnemonic here in first aid. Wanted to share that with you. Great job, everyone. Let's move on to our next question here.
Excellent. Thank you, Sean. Yeah. So again, this is one you really need to know going into to test day. So good stuff here. Well, before we get to our questions 3 and 4 tonight, just want to note that if you are out there right now thinking about, hey, I could use a coach, I could use a mentor to help me prepare for step 1. we're here for you. At Rx Coach, we've helped hundreds of students prepare for and perform at their best on step 1 and also for step 2 CK. And we have a very a specific approach. All of our our tutors are RX certified, and we started off with a robust 160 question assessment. And the whole point of that assessment is for us to get a complete understanding of where you're at. What are your strengths? What are your where are your challenges? What are the areas in which you need remediation? And where are some of the areas in which you don't necessarily need to spend as much time? And with that allows us to work with you to build a personalized study plan. So again, we use a one-on-one approach. So you would be paired with one of our coaches, and we're going to be there to help monitor your progress. And along with that, you'll also be getting access to all of our study tools at USMLE-Rx, including RX360 Plus, which includes Step 1 QMAX and the bricks. So again, we've got the link there in the chat. So go to rx-coach.com. You can set up that free consult to again learn about the program. And if you find that, yep, this is the right time for me, and for some of you, you may be getting ready for step 1 in 2 months. Some of you maybe later on in the year. We're here for you regardless of what your time frame is, and we want to make sure that we're helping you prepare for success. Now, I think a lot of you probably saw that the USMLE released the performance data from 2022, and the pass rates dropped significantly, right? I think the overall pass rate dropped from 88% in 2021 down to 82% last year, and I think nearly the total number was something like 9,700 students did not pass step 1 last year. So we want to make sure that you're taking this exam seriously, and we want to make sure that you are ready when that big day arrives. Okay, so again, go ahead to go to rx-coach.com and set up that free consult. We would love to talk with you. Okay, with that, let's go to question number 3. Okay, so you can look at this one and see, again, these are the types of questions that you're going to see on test day. A lot of information here. So we start again with that lead-in. Which of the following agents is the most likely cause of this patient's neurologic findings? Okay, so think about that. Think about what kind of content, what kind of data you might be looking for as we read the vignette. A 67-year-old man living with HIV comes to the emergency department because of headache, blurred vision, confusion, night sweats, and generalized weakness for the last 2 weeks. He says he has also lost 8 pounds during the last 2 weeks. Temperature is 38.8. Physical examination is unremarkable with the exception of lymphadenopathy. Laboratory testing shows a CD4 cell count of 80. MRI of the brain reveals a solitary lesion that is ring-enhancing and well circumscribed. He is treated with sulfadiazine and pyrimethamine, but worsens clinically. A repeat MRI 5 days later reveals that the lesion has grown in size. He dies 6 days after hospitalization. Brain autopsy reveals high-grade lesion with CD20 cells in an angiocentric pattern. Quite a story. So with that, let's read that lead in once more. Which of the following agents is the most likely cause of this patient's neurologic findings? Let us know how many steps you think it will take to solve this one as I pass it off to Sean.
Well, thank you. Let's go ahead and take a look at what we've highlighted for you. And questions like this, these are a great example of why we want you to read the lead in first, know how many steps it requires, so you can find the relevant clues and highlight them, because there's a lot of information here in this vignette. If you don't keep track of it, it's easy to get tripped up. And then not only that, but it's also easy to waste a lot of time going back through and trying to find clues later on, and that's going to take up time and prevent you from maybe getting other questions right down the road. So there's 2 things you can do: highlight and keep track of it, or also The longer ones, some students will elect to leave those and come back to them at the end so they don't waste too much time on these longer ones and maximize their points on test day. So whichever mentality works for you, there's no right or wrong answer to how you approach it. So let's take a look at what's important here. We're looking for an agent that's going to cause these findings, right? So now we're looking at a 67-year-old man who's got HIV. That's going to be very important, right? Anytime they tell you who's got anytime they mention any kind of pre-existing condition, you can count that as going to be either very, very important or a distractor, okay? Headache, blurred vision, confusion, night sweats, generalized weakness for 2 weeks. He lost some weight, 8 pounds in 2 weeks, got a temperature, got lymphadenopathy, a CD4 count of 80, and then you've got a solitary lesion that's ring enhancing and well circumscribed. Those right there are buzzwords that should have you have your brain ticking in the right direction here. Then we've got sulfadiazine and pyrimethamine treatments, but he worsens. Then another MRI shows that the lesion grows in size and he dies 6 days later. And then you do an autopsy and you see a high-grade lesion with CD20 cells and angiocentric patterns. So you've got a lot of clues here, and hopefully you'll pick up on them. This is a tough question. Not many people usually get it right. Let's see if we can turn that around today and uncover those answers, starting with E, Toxoplasma gondii, D, JC virus, C, Epstein-Barr virus, B, CMV or cytomegalovirus, and A, Cryptococcus neoformans. So with that, we're going to open up a poll and give you all a chance to lock in your answers.
Okay, here we go. So the poll is launched. Hopefully you've been able to break down all of that information, break down that vignette, and figure out, okay, which of these agents is most likely cause of this patient's issues. Let's see, about half of you have voted, so guys are off to a good start. We've got looks like one answer choice that is kind of running away with it, but all of the answer choices have been getting some votes. So let's go ahead and get ready to close the poll here. Just give you a few more seconds. You guys are doing a good job in your voting tonight. So let's go ahead and close the poll and share the results. So by far the favorite here was Epstein-Barr virus, about 42% of the vote, with Cryptococcus neoformans and Toxoplasma gondii both tied at 17 in the number 2 hole. But all of the answer choices got double-digit percentages. So let's go ahead and hide the results and see how we did. And the answer choice is indeed answer choice C, Epstein-Barr virus. So well done. That is another win for the Question Lab crowd. Nice job, everybody. If you didn't get it right, that's okay. We're going to walk you through it right now with Sean.
All righty. So, when we look at all these symptoms here, we've got to consider this person's got a, some kind of lymphoma, right? We've got CNS lesion in a patient with AIDS, and the CD4 count is less than 100. So that's telltale. So that, most people will think that's toxoplasmosis, right? Which is followed by some kind of CNS lymphoma. And you'll see that ring enhancing lesion, right? Now, because toxoplasmosis is common, what will happen is patients will be treated with the agents here, sulfadiazine and pyrimethamine. And if you have toxo, they'll respond to that clinically, and the ring enhancing lesion will diminish. In this case, it didn't diminish, right? So that tells us that it's some kind of primary CNS lymphoma. And primary CNS lymphoma is usually caused by EBV, and EBV is a herpes virus type 4, so HHV4, that infects B cells, right? So as a result of that, what you have here is a primary CNS lymphoma, which presents as a single ring-enhancing lesion, is caused by EBV, and it happens in patients who are immunocompromised. And when you see that CD4 count of less than 100, that's going to be a clue to help guide you in that direction. Okay, so that's why that's the right answer. The mechanism here is what happens. These viral proteins within these B cells, they'll inhibit apoptosis, promote proliferation, and they'll have protective mechanisms that will go unrecognized by cytotoxic T cells. So as a result, these unregulated B cells will keep replicating in the form of these lymphomas, okay? Now, why are the other answer choices incorrect? Well, we're looking at toxo. When toxo can also lead to brain abscesses, right? And also in AIDS patients. And it can also happen as ring enhancing lesion, but generally it'll be multiple ring enhancing lesions, not a singular one. Now, generally speaking, what will happen is 70% of people with toxo will have multiple ring enhancing lesions. 30% of them will have single ring enhancing lesions. So the way we could, rule that one out is that we gave a treatment for toxo and the ring enhancing lesion did not decrease in size. So that tells us that the lack of response to treatment is going to point to a primary CNS lymphoma. Our other incorrect answer choice here, JC virus. JC virus can be reactivated in people that have HIV, but generally you'll have, as a result of that, progressive multifocal leukoencephalopathy. That's not what we're seeing here. Those are not the symptoms we're seeing. Cytomegalovirus, that does happen also in HIV patients, but that'll cause encephalitis, okay? Encephalitis. So once again, not the correct answer. Then we've got answer choice A here, Cryptococcus neoformans, and that's a fungus, and that'll cause meningitis in individuals. So the most important clues here are going to be, the CD4 count, which will then help you narrow down a few of these answer choices. And then, of course, you look at the ring enhancing lesion. That's a big, big clue. And the other big clue being that you were able to give this patient 2 agents that are used to treat toxo, which could have been another answer choice that could have been correct. But those agents didn't help shrink that lesion, which then points to the only correct and best answer available, which is left, which is EBV or Epstein-Barr virus. So great job, everyone. Definitely a challenging question. But I will say we beat the average. So normally in the Q Bank, only 28% of people get it right. Today, 42% of you got it right. So it looks like we're dealing with a nice, intelligent group here and a bunch of successful future physicians. So Jeff, let's move on to the last one.
That sounds good. So again, yeah, we're impressed by everyone's performance tonight. So we're going to look to close strong here with question number 4. So again, this will be our final question of the night. We're going to have a raffle at the end of this, so hang tight along with a special offer. So we'll open this up, and again, we've got all of those answer choices covered up. We start with the lead-in. Which of the following fundoscopic findings is most likely in this patient? Okay, thanks. Take a look at this. Think about what it is they're looking for as we read the vignette. A 77-year-old man presents to the clinic with complaints of trouble reading, developing gradually over the past year. He has increasing difficulty seeing things in the center of his vision. He no longer drives amid family concerns about his vision impairment. He is otherwise healthy. He has a 50-pack-year history of smoking. Visual acuity is decreased bilaterally. Informal testing shows severe loss of central vision with intact peripheral vision. So again, which of the following fundoscopic findings is most likely in this patient? One more time, once you go down to the question box, let us know if you think this is a 1-step, 2-step, 3-step question as I pass it off to Sean.
Well, thank you very much, Jeff. Let's go ahead and go to the next slide here and take a look at some high yield points. So we've got a question. The question is, which of the following fundoscopic finding is going to be most likely? We've got a 77-year-old man, trouble reading developing gradually over the past year. So increasing difficulty seeing things in the center of his vision, no longer drives. 50-pack-year history of smoking. Visual acuity decreased bilaterally and severe loss of central vision with intact peripheral vision. Very important clues there. Let's take a look at those answer choices. Once again, we're going to start with answer choice E and work our way up. E, flame hemorrhages. D, extracellular lipid deposits. C, cotton wool spots. B, cherry red spot. And A, arteriovenous nicking. Let's go ahead and open up the poll and give you guys all a chance to lock in your answer.
Okay. So we're launching the poll here. Let's see if we can close strong here. Which of these fundoscopic findings do you think is most likely in this patient? We've had a good set of neuro questions tonight, and again, you guys have done a really nice job. So let's see how we do here on the final one. Looks like again, kind of this one, the results are a little bit more mixed. Let's see, about half of you have voted, so no clear favorite yet. give you about another 10 seconds. Okay, I'm going to go ahead and close the poll. Well, let's share the results. So again, interesting. So almost a three-way tie between extracellular lipid deposits, cotton wool spots, and arteriovenous nicking. But also, flame hemorrhages and cherry red spot both got a decent number of votes as well. So this is interesting. Let's go ahead and hide the results and reveal the answer. And the answer is answer choice D, extracellular lipid deposits. So we count that as a win because it was the leading vote getter, even though it was just squeaked by cotton wool spots. But regardless, this was definitely a tougher one. But don't worry, because Sean's going to be here to help walk you through it. Sean?
Well, thank you, Jeff. Definitely a challenging question. So one key thing here is whenever you see central vision loss with normal peripheral vision, you need to start thinking about dry age-related macular degeneration. So you'll have a gradual onset of symptoms and smoking history, big clues, okay? And this is going to be a very common cause of bilateral insidious blindness in the elderly, right? So you'll see central vision loss with blind spots, and we call those scotomas. And that's characteristic and often progresses for longer than a decade before it stabilizes. And the central vision loss happens due to the involvement of the macula in the disease progression. So how do you test it? You do a fundoscopic examination with dry age-related macular degeneration. You're going to see what we call extracellular lipid deposits, okay? And these will progressively lead to atrophy of the retinal pigment epithelium, which will then appear as lighter pigmented regions near the macula, and you see the arrows pointing to that there. So once again, dry age-related macular degeneration will present with insidious onset of bilateral central vision loss in elderly patients over the course of years. And when you do the fundoscopic examination in patients with, once again, dry age-related macular degeneration, you're going to see extracellular lipid deposits. So what are the buzzwords here to get you that answer? Once again, loss of central vision, intact peripheral vision, and that pack of the 50-year pack of smoking. That those are great clues to get you there. And that one word there, it happened gradually over time. Okay, so good job. I know this was a tough question. Let's take a look and see why the other answers are incorrect. Flame hemorrhages as well as arteriovenous nicking, both of those would be seen in hypertensive retinopathy. And some people may have leaned that direction because of the history of smoking, right? And if we look here, let me see how many picked that. Right? Yeah, 23% of you picked arteriovenous nicking, and 14% of you picked flame hemorrhages. So if you combine that, more people picked those two than the correct answer. And the reason and the way to avoid both those falling into both those traps is simply realizing that the symptom profile is different. Okay, we're not talking about hypertension here because this person smoked and may be in poor health, et cetera, et cetera. We're talking specifically about the vision loss here. And you see here, loss of central vision, intact peripheral vision. You're not going to see that with hypertensive retinopathy, okay? So there's that one. Let's take a look here at cotton wool spots. Cotton wool spots, that happens in diabetic retinopathy. And what will happen there is you'll have a retinal nerve fiber ischemia. Once again, not what we're seeing here. Cherry red spot, that was our least popular answer. That's because that's a pretty big buzzword there. We see that with different conditions. But we're going to see that in central retinal artery occlusion. So once again, these visual field defects, as well as certain visual symptoms, they're very specific to certain conditions. And if you know what those are, and you can put those buzzwords together, you can kind of narrow it down. But this was a challenging question. There were some clues in there that could throw you off your A game. But once again, I want to repeat this because I like repeating things just to make sure that it's ingrained in your head. So my teaching style for about 12 years now. Whenever you see smoking, gradual loss of vision, and it says central vision loss, but peripheral vision is intact, I want you to start thinking about dry age-related macular degeneration. And whenever you have that, you're going to see these lipid deposits. So great job, everyone. I'll hand it back over to you, Jeff.
Excellent. Thanks, Sean. Again, great job, everyone. This is, these are all tough questions, and we are, just, really happy that you guys were all able to carve out some time and focus on getting better, right? Focusing on a tricky area and also kind of learning some of the best practices. So I've got all of the QIDs from QMax here on the screen. So screenshot this, write them down, whatever you want to do. You can go to USMLE-Rx and put these into the search, and you can again review the questions and go deeper, obviously, with the explanations that so along with seeing those explanations, you'll see everything about that question that shows up in first aid, all of the the bricks, all of the flash facts, and the express videos for that. So again, make sure if you want to follow up, especially on any of those items that you either struggled with or feel like you need to dig deeper in.